my name is Rakhi Naik. I'm a classical hematologist at Johns Hopkins University, and I also am the chair of the Fellowship Program for the American Society of Hematology. Um, in terms of the background of why we started the ASH HFFTP, so part of it was that there was a workforce study that was performed through the American Society of Hematology to try and see what does a landscape of hematology look like. And it turns out that in terms of classical hematology, there was a big dearth of having new talent come in. So we were noticing that there's a lot of people who were trained back in the 70s and 80s who are now retiring, but that there was not a new crop of fellows who were coming in. And part of the reason we think that was happening is because there was a shift from having fellowship programs that were separate between medical oncology and hematology, and they became combined around the 80s. And so a lot of the emphasis of these larger programs was on oncology. And that part of that is because it's shiny, it was new at the time, there was a lot of funding going into oncology. But what happened over time was that we weren't training people to want to do classical hematology or to specialize in it. And so we ended up with a group of trainees who were very well trained in oncology, but not so good in hematology. And so that's the landscape that we're in right now, and part of the impetus for starting the ASH HFFTP program. So one of the things in hematology, as was mentioned, is that it is a lifespan disease for many of these congenital hematologic problems like hemophilia and sickle cell disease. And the lifespan of sickle cell patients here in the United States really has increased from being a disease of childhood to now a disease of adults. And because it had that the disease biology has changed, our training has not always kept up with that. So we don't have as many people who are interested in classical hematology and specifically these congenital disorders in the adult space. And so that has really created a problem. The other thing I will mention is obviously, yes, oncology has more funding, it seems more shiny, but there's a lot of new developments that are happening in hematology, not only among the congenital space. So for example, there's been super exciting things in the sickle cell space where gene therapy was just approved by the FDA in December of 2023. Super exciting. We also have other curative therapies like bone marrow transplant for that. In terms of hemophilia, there's new targeted medications like emicizumab that really have changed the landscape of hematology and hemophilia care. And that requires a lot of expertise. The other things are although we're talking about these congenital diseases, which are can be pretty rare, hematology really affects almost all of the population. So we have a lot of patients, for example, who have atrial fibrillation, which is an arrhythmia of the heart that require blood thinners, and they need to be on blood thinners. There's so many new blood thinners. There's been an explosion of new therapies within the blood thinner space. And there really, again, needs to be experts who can really speak to what types of anticoagulants to use in those settings. And for example, there are complications of people who are on blood thinners, like bleeding complications. So there need to be people who have expertise in how to reverse those anticoagulations. So we've really sort of moved to their being a huge need for hematology, especially in the adult space. And that is obviously what we're trying to address with the ASH HFFTP program and other programs. So I think the goal of the ASH HFFTP program is really to make sure that we have training programs that are focused very specifically on hematology training so that you have 50% of your time that's spent doing classical hematology, but 50% of your time is also spent learning about hematologic malignancies, where there is a lot of overlap with some of these non-malignant conditions. So the training is very comprehensive. The hope is to have then providers who come out who are very versed in not only benign hematology problems or classical hematology problems, but also heme malignancies, and so that we can integrate that care more. Our goal is really to increase the number of people in academics who have this particular focus and expertise so that they can deal with a wide variety of hematologic conditions, like either congenital hematologic conditions, acquired ones that occur during adulthood, and those other populations that are overlapping with other disciplines like cardiology, we have some people who are interested in ICU care, for example, or there are some overlaps with kidney disease. So there's a lot of overlap that can happen with hematology and other disciplines. And part of the HFFTP program is really to come up with innovative curriculum where we have curriculum not only for hematology and for classical and malignant hematology, but also these overlaps, so that we're training people to branch outside our natural confines of the specialty, because we're needed everywhere. Yeah, I think that's a really great question. I think there is a lot of overlap between all of the hematologic conditions. So anything that really comes from the blood. So in some ways, it does make a lot of sense to just call us all hematologists because that's what we deal with. Part of the reason for why there has been a carve out for classical hematology is because specifically that some of the classical hematology diseases don't fall under the umbrella of oncology, like heme malignancies sometimes can. And so therefore, there was a need to sort of carve that out. But I think in the longer term, for sure, we should call ourselves hematologists in general. And once we can bring that back, bring the heme malignancy back to the hematology side, I think that's going to be really advantageous to all of us. I will say just in terms of the other parts of the terminology. So classical hematology, I think, is something, unfortunately, that most providers don't use that term. And so therefore they don't know what it is. And then it does require a lot of a qualifier. I agree that benign hematology has a lot of problems with that terminology because obviously our diseases are not benign. Non-malignant hematology, on the other hand, I do think is a little bit more universally understood because it is a counter to malignant hematology, although for sure it has a lot of problems in and of itself that we don't want to define ourselves but by the diseases, what we are not. That being said, I think any of those terminologies is fine by us as long as we're recruiting into this discipline, which is people who are taking care of individuals who have blood disorders that may not be under the umbrella of oncology. I think the future of hematology is very bright. We've had a lot of success with the HFFTP program in terms of enticing trainees to want to do classical hematology, to see role models in classical hematology and the way in which their careers can develop and flourish in this space. And as mentioned before, there's a lot of new therapies, a lot of new investigation that can happen in this space. So I think we're very excited about the future. We've seen a lot more interest actually over the last couple of years. I have been doing this in terms of trying to recruit into a hematology-focused fellowship since about 2016. So even before the HFFTP program started, and I have seen a tremendous increase in trainees who are interested in this. So I do think the future is bright. In terms of finding out more information, there is obviously an ASH website, the ASH HFFTP website that shows all of our consortium members. We now have 12 different institutions that have these specialized tracks all throughout the country, from the East to the Midwest to the West Coast. So if you are interested in it, for sure, check that out. And there are descriptions of all of the innovative curriculum and all the programs on the website.